And there we go. There we go. Okay. So I wanted to ask about being a woman of color and accessing care.
Oh,
I know. Sorry.
yeah, no, that's a big one. So um, I think my experience as a woman of color, I think for me was both devastating and at the same time, I would say like quite eye-opening. And the saddest part, I think, is that like when I went back to do research for my book, is that what I saw was that my experience wasn't like, atypical. It wasn't some kind of, aberration or anomaly. Like I remember like very early on, like I'm gonna discount my whole experience the first time in getting help because that was in the early 2000s. So I'm just gonna say, okay, maybe not a lot was known about postpartum psychosis. But
Yeah.
yeah, but I think by the time I had it the second time, I think that there was enough information out there, especially because of like the whole Andrea Yates thing. She kind of really put postpartum psychosis on the map, right? But even still, like when I went in for help, like very early on, I felt like I was not being listened to. Like I literally saw that my doctor wasn't even taking any notes. It kind of felt more like a social visit. Like it was like she wasn't even like taking notes on what I was saying. And even when I went back, like after my whole experience, when I went back to look at notes from that time, I noticed that in those early visits, there was nothing really even recorded about why I went in.
Oh my gosh.
It might very well have been a social visit.
Yeah.
And I remember in those early meets, like she never even like was asking me questions about my symptoms, the nature of my symptoms, like when it was occurring or anything like that. And then like after
It
that, like
sounds like you were just kind of told that this is just normal. Like,
yes, definitely. It was like, oh, you're grieving. Like, but I was like, but I didn't, I don't, I felt like I'm over it. Like I had made peace about it. And still I was being told, no, you're grieving. Like as if I wouldn't feel like, as if I wouldn't be the best person to know if I was grieving, you know?
yeah.
And after that, it was kind of like really bothersome that not even like out of all the times that I went, I wasn't even being screened for any type of like like the I think it's called the Eden is it called the Edinburgh.
Yeah. Edinburgh depression, postnatal, perinatal depression scale. There we go.
Yeah, and nobody thought to even do that on me,
I
even
do
though
have
like
to say that one's a little complicated to score
oh okay, but
and
I
it,
mean
it needs
they
to be
never
signed
did.
off by a doctor, but the PHQ-9 will work just fine.
Yeah, so they never did anything, even though like one of the psychologists that I went to like commented about like the fact that I should brush my teeth and take a bath. So they were noticing certain things, but like you know what, like obviously if I'm in a state where you're commenting that I should be brushing my teeth and taking a bath, well, surely you could have done some type of
Yeah.
screening on me, right? But like the only person that ever thought to do a screening was the resident, and we kind of all know that residents like to be very by the book, right? So I chalk it up to kind of that, and she didn't even get through it because I was like so out of control by that
Oh
appointment.
no.
And then it was like so concerning that even though like I confided to the doctor, like not confided, it was more like a confession that I know I basically told her I feel like doing evil things but I don't want to, and I wanted to be hospitalized. Like even that didn't warrant like a screening, nothing.
Yeah, I
And
think I actually screamed.
yeah, and
Reading that.
yeah, because I mean, although I didn't exactly say what it was that I felt like doing, when she said like what kind of bad things, I basically said evil. You don't use that word for just like, you know what, I feel like sticking my tongue out at somebody. That doesn't qualify as evil. Like I was
Mhm.
trying to communicate that this was like something really atrocious. And like I would have thought that that would have made alarm bells go off, or like somebody just asking to be hospitalized. Like what kind of person in their sane rational mind wants to be like locked up? Like it was like really horrible. And I really do think that a lot of that, like based on the research that I've done, a lot of that kind of mirrors what we see with that happens to women of color, like just kind of being dismissed, ignored, like you know not putting much weight to anything that's being said. So
Mhm.
yeah, so I
And
really do
I
feel
was
like
curious if that even started during pregnancy, if you felt like your symptoms weren't listened to.
You know what? I've never thought back to that, but one thing that maybe I should blame myself for it, but
Oh no.
I don't like alarmist doctors. So, if she did do that, I kind of was probably like, yeah, I don't want to be alarmed by anything. So I probably took that as something, good to be good, like because she wasn't so like, you
Oh,
know, but the fact that it wasn't just her and like five different people engaged in this kind of behavior is what's like concerning. Like maybe if she had done, if my GP had done that, then I would have been like, okay, like that's her personality. But like when you see it as like a pattern of behavior across very different personalities, then I think it becomes like, okay, wait, what's going on here? Type of thing, you know?
yeah. Well, I was just thinking about like your prenatal care
Mhm.
with your daughter, and if there was anything that could have put you at increased risk, like do you think that you got good enough care? Did you have any complications during that pregnancy?
No, no, my pregnancy was really good, and I
Okay.
actually loved being pregnant. Like it was like it's something that I always wanted, and I loved how I felt when I was pregnant. It just seems like the postpartum doesn't work for me.
Yeah. Yeah. Well, you are not alone.
Yeah. Yeah, I think
Um,
I'm in the company of a lot of people out there.
mhm.
Yeah.
Yeah. Um, and gosh, okay. So you really didn't have any risk factors other than being a woman of color.
Hmm.
You didn't have any mental health history. You didn't have, I mean, with the first pregnancy, there weren't complications. You got good prenatal care.
Hmm.
Do you think that also, because I mean, you're like a really smart lady. I don't know what you do in your real
Yeah.
life, and that's okay. But I mean, do you think that people had a lot of misconceptions about intelligent people being able to experience psychosis?
Yeah, I definitely do think that that plays a role into it, because it must have played some kind of role, because when I went back and looked through some of the reports where things were documented, people like, I didn't realize that doctors write about more than just your symptoms. They write about how you present and things like that in the notes. That was
Yeah.
a shocker to me. So I just kept reading, and it was like really confusing, because when I did go back to look at the notes, I was like, how come it doesn't say that I was reporting hearing voices? How come it doesn't say I asked to be hospitalized? Thankfully, I had witnesses to all of those things.
Oh,
But
good.
the reports, none of those things are written. But what is written is things like, patient is very articulate. Patient is
Oh,
very, things like that were reported. So,
uh-huh.
and I was just like, so then I thought to myself, is it like, is it those kinds of things that they were kind of like, oh, she can't be, out of her mind. She's articulate. Like, do you know what I mean? So
Yeah.
I think maybe some of that, because I was like, where's the important stuff? Like, I'm hearing voices. I feel like doing evil things. None of that stuff was written down. But it's like, patient is insightful. Patient is disturbed by thoughts. Patient is articulate. People, like, those kinds of
Yeah.
things.
Yes.
Yeah. So maybe. And I was just like, oh, they comment about different types of things, not just like you're, got
Oh,
a grainy cough or anything like that.
yeah. Yeah, sometimes I get really colorful with my my mental status exams just for fun, especially
Yeah.
if there's like a fanny pack and it's neon orange and Ricky Martin involved. So,
Yeah. But now that it's been like about 10 years, I would like to go back and read over those again, just like,
yeah.
post write the book and everything like that. Like I remember I looked through those notes about 2 years after everything had happened to kind of see if I could file some complaints. But I was like, dang, these notes, they've left out all the important stuff.
Oh my gosh. Yeah. Oh my, and that's just so upsetting too, because I I think that they really didn't hear you.
Yeah.
Because even they didn't put it in the note, and that's just so weird.
Yeah, and
Um,
I almost felt like I was being gaslit, because then I was like, wait, didn't I do remember saying all these things. And thankfully, like in some of these appointments, it was my husband, my mother, my best friend, like all these people, and they were like, yes, you did say that. And that's why we had this and this conversation with, like, you know what I mean? But
Yeah.
looking at the notes, you had a very different idea of what was going on. So yeah, definitely I was not being heard. And I think some of that, like what you're just saying, like this perception that like, oh, well, like we know, sorry to use a term, but we know what crazy looks like type of thing. Like, you know, and if you're this educated person, then you can't, you know, you don't fit into this whole type of thing. So I think that that's a
Yeah.
really big problem.
I think so too, because, and I work with my students on this because, there's like an assumption that like only people from low income or not educated backgrounds get psychosis. And I just get so pissed off because it affects everyone. I've had plenty, I mean, this just doesn't discriminate against
Yes.
anyone. We discriminate, but
Yeah.
psychosis doesn't discriminate against anyone. And you know, just the fact that you had to seek care so many times. I mean,
Hmm.
thank goodness you did. Um,
Yeah.
and finally got some help. But and then
And
my
you
heart just like broke that you never got care after the first pregnancy.
Yeah, and the other thing too is that like I'm from Canada, right? So like we don't have these issues around like, you know, like healthcare coverage and things like that because we have
Yeah.
universal healthcare. And that's another thing that really makes me like sad because there was nothing preventing me from going to 100 doctors. Like, I mean, if I had the will inside of me, I could go to 100 doctors and not have to worry about how I would pay for this or anything like that. And that's what like is like devastates my heart when I think about, because when I do help now women, like when sometimes I talk to families and I'm like, no, you need to get yourself into to a hospital, you need to be seen by a provider, then they're like, well, like if it's nothing, then you know I don't have coverage and I'm going to have to be. And I think, oh my gosh, like if this person then went through the same kind of trajectory that I went to, they would definitely have a tragic outcome because they
Hmm.
wouldn't be willing to go 5 times. That one dismissal would be like done, one and
Hmm.
done, we're not
Yeah, because you
so
like the ER bill alone is just enough to break you, and
yeah, so it's
then
like
a lot of these women have just had a baby too. And
yeah,
yeah.
so it's really tragic. And sadly I find that like even in the cases that I'm fortunate enough to help, I see this pattern continuing. I like anytime people are given pushback and dismissed, I'm not saying that it doesn't happen to white women that they're not dismissed. We see cases of that. Like I feel like Lindsay Clancy situation was like she definitely thought something was going on and got herself, you know, voluntarily admitted, and she wasn't being properly diagnosed with anything. I don't think she ever was labeled postpartum anything as well.
Oh,
And I
wow.
feel for her. But this definitely happens like in the people that contact me, more BIPOC women are experiencing this kind of dismissal. Like I helped this one woman and she was a black woman and she basically she's postpartum and she's raving like acutely psychotic saying that you know her husband is doing this and you guys are using telling the doctors that they're using her as a test guinea pig, and they just said go home, we have actual
Oh,
sick people to treat.
oh my
they,
God.
they actually said that to her in the emergency room and I was
Yeah.
like what, like this is probably the sickest woman you're going to see tonight. Like she's
Hmm.
got a newborn and she's like ranting and raving about her delusions, and you actually have the audacity to tell her that you have real sick people to treat. like like and you know what, like it tends to happen more to people of color, sadly. And I think it's because of, you know what, like there is medical racism, like racism seeps into everything.
Yeah, it impacts so many things. And like I definitely see it in my practice with just even women being able to access their prenatal care. And I had one patient with a woman of color that she had preeclampsia.
Hmm.
Um and she had to get readmitted, but she had to present to the ER like 4 times before she could get readmitted, even though her blood pressure was through the roof and she had headaches and everything, and nobody was taking her seriously. And it's like, I mean, she already had just been discharged from the hospital for this condition. Why wouldn't you like
Yeah.
obvious like it's not. Like you have to be a genius to figure out what the condition is at all. It's
Yeah.
already in the paperwork.
Yeah.
Um,
And
you know,
it's shocking. Like I remember like after I got better, like and I was so surprised by how quickly I got better once my perinatal psychiatrist prescribed me the right dose of antipsychotic medication. And when I came out of it all, I was just like, I said to her, like, why do you think nobody helped me? Um, and she said something that was really bizarre. She said, maybe they thought you were malingering. And I thought to myself,
oh my
what?
gosh.
Why would they think I'm malingering? It's not like I killed somebody. It's not like, do you know what I mean?
Yeah.
Like what? But she's
Like
probably
trying to
right.
get drugs, maybe.
Yeah, or some or like just wanting attention. I don't know, but like first I
Oh
was like,
my,
what a weird thing. But then later on I thought maybe that is, but why was that their immediate thing? Like this woman keeps coming to the doctor. And why is your first thought that this woman is malingering and faking like a really serious condition? Like to get what? To get admitted to the hospital? Like,
right?
like so it's just like really like saddening, shocking, eye-opening, but
I think a lot of people are more concerned about, and are more concerned about the baby. Like if I admit mom, who's going to take care of the baby? And
oh,
um, it,
but that's the best way to keep the baby safe.
I know it's so bad, but like that has certainly been a barrier for my patients.
Hmm.
And like I just like, and as a psychiatrist, you're supposed to have like all these boundaries and everything, and you know not do these things. But like I'm like, oh my gosh, like I will take care of the baby overnight. Like why won't the family members take care of the baby
Yeah,
overnight so that she can get admitted for this?
yeah, yeah. And it's just, I don't know, like it's like I wish I could be inside of their headspace to think, to see what was actually going on in their heads while they were dismissing me.
Yeah,
I don't really know, but like
they were probably tired and hungry.
you think I went at all different times of the day.
Okay, well, let's just give them the benefit of the doubt that they were tired and hungry.
Yeah. But
But
you know
yeah,
what? Like, hopefully maybe one or two of them will read my book and be like, hey,
I
remember
know,
me?
right?
Yeah. I mean,
Yeah.
I only gave it to the one that actually helped me. So
Oh, good.
yeah.
And then when I was reading through, there was a point where your psychiatrist mentioned that you were moving really, really, really slowly.
Mhm.
And I don't know if she ever brought up catatonia with you or if you ever got treatment for that or anything like that. But that's something that you can see pretty commonly with a bipolar disorder or with psychosis or any mood kind of episode. And it would get better with the clonazepam that you took, but you described feeling a little foggy with the clonazepam. So,
Oh, you mean that should get better with the clonazepam?
yeah, like if you have this like slowing and you're kind of like maybe postured or stuck in a position or not eating and drinking or having some kind of bizarre behaviors, sometimes like people will just like kind of randomly lash out and attack people or do the exact it's like an automatic obedience or a negativism, so like they'll do exactly what you say, or even just like sometimes they'll like copy you,
Oh,
and like I can go like this and they'll go like this as well. uh,
oh.
it's, uh but
My psychiatrist never brought up that, but what she did point out was at one point when she tried to wean me off of, like I came off of my antipsychotic medication after about 3 months, but I had to stay on the antidepressants for like a year and a half. And one time when I was trying to come off of the antidepressants, I had like a relapse. And at that time, also, I became very psychomotor retardation. Like I became
uh-huh.
very slow. So she said, like at that time she said it seems like you have like a very biological type of depression that is like melancholic, like very
Yeah,
like
that's another way of looking at it. Hmm.
yeah, I don't know. So she kind of just, that's one thing that we noticed, even though in that relapse I never became psychotic. I just had to go back on my antidepressant for more time, but like immediately, like I slowed down and seemed like I had like developmental like delays. Like I
Oh, how
I couldn't
fascinating.
ability. Yeah,
That must have
like,
been scary. That must have been so scary.
well, I didn't really notice it, but
Okay,
like
good.
videos and stuff that people have of me, I'm like, oh yes, like literally like talking like that, and my movements are so slow. Like,
Oh,
um,
wow.
yeah. Have you ever seen that?
Oh, yeah. No, that I mean it does sound like catatonia.
Yeah.
So
But
it,
once I got back on the antidepressant, that, went away.
yeah. Well, I'm glad that it went away without you having to get like a whole bunch of benzos, but usually well, a lot of times they'll require some benzos and maybe even have like Susanna Callahan, she probably had some elements of catatonia. And
Yeah.
she got all the she got all the medicines.
Yeah. That was one thing that was similar, but like when I spoke to her, I had the opportunity to talk with
Oh, how
someone.
cool.
Yeah, yeah. So before she blurbed my book, she helped me a lot, like in terms of giving me advice and stuff. And I told her like one similarity was like I think in her book she writes about the fact that one of the doctors thought that the psychiatrist thought that she was developmentally slow, and I said that was like my psychiatrist when she met me. She thought I was like, I had some developmental challenges, and at
Yeah.
the time I was like so like my brain processed it, and I was like, what is she saying about me? Like, do you know what I mean?
Oh,
Yeah. But that is really interesting because the clonazepam actually made me feel more slow.
yeah. And if it had been catatonia, I think that you probably would have like kind of most people will wake up a little bit and perk up, which is so bizarre because clonazepam for most people had the reaction you had,
Hmm.
and get tired or kind of sleepy with it. So, but
Yeah, that's what it did to me. It didn't help it.
okay. And
Yeah.
then they chose Effexor, or venlafaxine. Do you know why your psychiatrist chose that?
No, I think she was just continuing because that was what I was prescribed for the panic attack that I was
Oh,
diagnosed with, right? So they put me on clonazepam and Effexor.
okay.
And I guess she was just like I'm assuming that probably because when she heard my first story of postpartum psychosis, she was like, it seemed like I was depressed and had some psychotic features there. And so she thought that would be, she didn't think I was acutely psychotic when she put me on that tiny dose, but I was full psychotic.
Oh yeah.
Yeah.
Well, it's an interesting choice because it's a very, very strong antidepressant. It's one of my favorites, but
Oh,
it's really hard to get off of too, which is one of the things I usually include in the consent for it. Like, oh, by the way, like
uh-huh.
this is hard to. Did you have any withdrawal symptoms from it, or if you
No,
ever
so
missed doses?
after that first relapse, when I guess it was too early to come off of it, you know what really worked? Because I'm the type of person like I get addicted to Tylenol and Advil. Like if I take it for like 3 or 4 days, I'm addicted. I need it for
Oh
like the
no.
rest of my life. So you can imagine the fear of coming off. But you know what my psychiatrist actually did? Like when it came down to the last dose for Effexor, I started feeling really nauseous, and so she prescribed me what was it? Prozac. And she said because it has a longer half-life,
Hmm.
and that just like I was like, wow, there's no withdrawal symptoms. Like that Prozac just tided me over, and it was
Hmm.
fine.
Yeah.
So
That's
that's why I always tell everybody, no,
yeah.
you don't need a GP. You need a perinatal psychiatrist, one that knows how to take you off stuff, knows what's good for you when you're breastfeeding, all that. No, I don't want to hear it. Just go to a perinatal psychiatrist.
Yeah, and that we're so hard to find. But I think you've like connected with Postpartum Support International,
Mhm.
and that's a really good resource for finding
Yeah.
reproductive and perinatal psychiatrists, and then also the International Society of Reproductive Psychiatry. There's
Oh,
like what is it like? Well, we have a map with like everybody's location and everything on there. So
oh wow,
go
that's
to your
great.
state and figure out who's available there. And
Yeah.
hopefully it's a worldwide map. I've only lived in the US though.
Yeah, and through my Instagram account, I've connected with a lot of reproductive perinatal psychiatrists. So I'm so grateful. So anybody like, I'm like, okay, I know this one in, Tallahassee. I know this one in, it's like good because I really do think that like, perinatal psychiatry is like so important because if this is the most vulnerable time for a woman, like for her in terms of her mental health, that postpartum period, then and you already have all these anxieties and worries about like what can you take, what's safe, all this kind of stuff,
Mhm.
then this is where you need the most number of people. I don't know if it's the same for you guys, but I know in Canada where I'm from, like the perinatal psychiatrists, like you can't see them after 12 months.
Oh, really? Oh, well, I mean, oh, that's so interesting. I don't think there's enough of us for us to even have that rule in the US. I mean, I think that there's maybe 16 to 32 fellowship spots. And when I graduated in 2016, I had no idea that there was even a fellowship option in it.
Oh,
And I had spent a lot of time detoxing pregnant women off of opioids in Nashville, Tennessee. A
oh,
lot.
and you still didn't know about that.
I still didn't, I mean, that's how I got into reproductive psychiatry is because I had already prescribed all these pregnant women methadone and buprenorphine. So like, after prescribing those, you kind of have lost your anxiety about prescribing medications to pregnant women.
Oh, okay, yeah.
Um, but
Yeah, I
I knew there were lots of options. And so when 2020 hit, I actually had all these pregnant women coming to see me telemedicine who had been abandoned by their psychiatrist.
oh, and that's what fueled you into reproductive psychiatry?
Yeah, that's what kind of got me into it because before this I was in homeless outreach and working in assertive community treatment. So, but actually the skills translate very well because I mean, pregnant women are complex medically and you have to keep track of them, very close track of them and make
Yeah,
sure that they're doing okay. And like you certainly cannot you have to work really hard to have trust and be
yeah,
consistent
yeah,
um, and follow them for a long time. I
yeah.
mean, I try
So
to get my women very healthy before pregnancy and then during pregnancy and then after.
yeah, but so can you do take women that are past 12 months?
Oh yeah. Well, I mean, yeah, of course. Yeah.
Yeah. Oh, okay, no, because I don't know if it's because maybe here it's different because like because we have
Because
universal
there's actually
healthcare.
organization.
No, no, like because we have universal healthcare and then they want to make sure that all the postpartum women can be seen. So they kind of cut like if they're like 12 months postpartum, then they can't be seen by perinatal psychiatrists anymore, which is so sad. And I'm like, okay, now I'll try to find somebody
Yeah.
else for you. But
Because for someone like you, I would always want you to be taken care of by a reproductive psychiatrist.
yeah, and the good thing for me is that although I'm not perinatal and entering menopause,
And
um
that's another high risk time for women,
yeah,
though.
yeah. But no, but my because I was seen by that psychiatrist, I always have like an open door policy
Okay.
with her. So she's always like, anytime, you see walls melting, you can pick up. So
Good. I mean, I'm so glad that you have her as
yeah,
a
yeah.
resource.
Is
Yeah.
it yeah, amazing. So and I think that's the case. Like people that were her patients from before, during the postpartum period can see her like later on in life. But I mean, as a new patient, she only take like not just her, but all the perinatal psychiatrists only take women up till 12 months.
Oh, wow.
So like if you're 13 months and you start experiencing symptoms, it's like you can't see a perinatal psychiatrist anymore, which is sad.
Yeah, it is so sad. And like, I mean, what is postpartum? I mean, for me, I feel like I had a lot of cognitive deficits postpartum that were extremely obnoxious and they persisted for at least 2 years. And
Yeah.
I don't think anyone else could notice them but me. But I mean, I had word finding difficulty and I'm not as funny as I used to be. I'm getting,
What?
I used to
That's
be
scary.
I actually used to be a lot funnier and like quitted before having a kid, but now this is not all there.
Okay, well then I don't feel so bad confessing this. I used to be like the best hula hooper in the world, but ever since I had that psychomotor retardation issue, I cannot hula hoop anymore.
It's so fascinating. That
It's
is so fast. I wonder what happened.
I don't know, but somehow well, if it had to take away one skill of mine, I guess
Yeah.
that's an okay skill to go.
Oh my gosh. That is so, I mean, I wonder if that is so fast. I'm gonna have to think about that. That's really fascinating. And any other skills that you lost or felt like?
No, no, no. I didn't lose, just the hula hooping. I
Just,
cannot, I'm disappointed I cannot make it into the Guinness Book of World Records, but you know,
yeah, you should have done that before and had a
yeah,
plan.
darn it.
God.
Yeah.
Oh my gosh, that is so interesting. I will have to think about why on earth that would happen. And can you swim still?
No, I actually learned to swim after.
Oh, okay.
I didn't know how to swim before, but I've become more brave as a result of having experienced postpartum psychosis. I
Oh, good.
genuinely feel like that because my world is kind of like, listen, if the walls aren't talking to you, everything is good. So my like yardstick of what is like, like I can do all these things that I never thought of doing before because now my litmus of like what
Yeah.
means what's scary is like different. Like, do you know what I mean?
Yes, it makes so much sense. Yeah, like, oh, whatever. God's
Yeah.
not talking to me today, so I can do what I want.
Yeah, exactly.
Oh
Yeah.
my gosh. But I mean, that's so wonderful that like it's led to so many doors opening for you and you've moved on and advocated for so many women. You're so cool. You're just like so
Uh, not
uh
half as cool as you, but maybe
oh,
one day.
oh God, no, no, no. But and then I so wish that you could have been at this conference that I was just at because you would have loved it and everybody would have been so excited to like, meet you and
Oh,
hear your story. But it was so great. And you would not believe how packed that menopause lecture was. Like
oh wow.
I had to really shove my way in there to get in,
Oh,
to actually get in there. So hopefully we find out more things about managing perimenopause and the
yeah.
next life transition for you and for me because I'm gonna be entering that one soon.
Okay, well, I'm passing through it, and so far everything's been good. And
Okay.
I'll share any tips, but you have the greatest tips on there, like about being.
Effexor, just so you know, hot flashes is it might help.
Yeah. What helps? I have never had a hot flash, but what helps with it?
Oh, Effexor. Effexor.
Effexor helps. So
Mhm.
okay, I've never had one yet, so
Yeah.
not needed it yet. But I don't know. I've been having like a couple of crazy symptoms, but maybe who knows? I don't even know if they're perimenopausal. If I should just check it out with a GP.
They probably are. I mean, the more I learn about it, the more wild it is. And like the big thing that I see all the time is women having problems with concentration.
Oh
And
yes.
like you're kind of at like the height of your career too during this transition, and then you're having trouble with concentration. It's like, oh my gosh, like bye.
Yeah.
So,
Sure. But you know what? And if it was something that afflicted men, they would have like 5 years off during that time of
oh
their
my
life.
gosh.
Just so that they can grade it all together and come back in there, when they're all done.
Oh my gosh. Yeah, it's so true. I mean, they have it so I can't. It's just so different. It's just so different. And oh,
But I'm glad
yeah.
there's so much more research being done into mental health, like into the mental health side of like perimenopause, menopause. I think for too long that's been neglected,
Oh
right?
yeah. Hmm.
Yeah.
Yeah.
So looking forward to some of those insights as well.
Yeah. Well, I will definitely post on them as I learn more and more and more.
Okay. Uh, did you have any other questions for me?
Um, gosh. I mean, no, do you feel like you're fully recovered?
Yeah, yeah, definitely. I feel like I'm fully recovered. For the longest time, I always used to be scared that, postpartum, I think that this is probably natural. Like I always used to feel like, what if it came back? What if it like suddenly came back? And I had to rebook a couple of sessions with my psychiatrist because I was always scared, like, what if it suddenly like came back into my life? And she was really good about like telling me like, you know what, like we have a plan. Like if you ever feel
Oh, I
like
love this woman.
yeah, she's like, you notice that in the both times that you're feeling depressed for a period of like a week or 2 weeks. So as soon as that starts to happen, you need to touch base. And
Oh my
so
God.
once I had like a plan, like that I know that I can go to, like I felt so much like relief. And so
Yeah.
I'm not scared of that happening. I mean, although my mind knows like it only happens postpartum for me, still there's like just because it was like the worst experience of my life in addition to not being able to get help,
Yeah.
um, like it's always there for me as like a trauma, I think. But making that sitting and making that plan with her really like helps me, because whenever that thought creeps into my head, like, oh my gosh, what if, then I'm like, no girl, you got a plan. You're going to touch base if you're feeling depressed for more than like a week, type of thing, so
Exactly.
yeah.
Yes. And it's so much easier to treat depression. So, in order for you to meet criteria for depression, it's 2 weeks. And
Hmm.
it's so much easier to treat depression early on
Yeah.
than after it sits and kind of festers for a while. Um,
Yeah.
One thing you might like, I don't know, that I have my patients do is I have them monitor their PHQ-9 score. And if it's over 10 for like 2 weeks or more, I have them give me a call so that we can increase their medicine.
Oh, okay. So PHQ is like a questionnaire?
Yeah, it's just like a 9 item questionnaire and it's super easy to fill out. And it gives you a good idea of like if you are like having some depressive symptoms and
Hmm.
you don't want to do it more often than every 2 weeks,
Oh, okay.
but like if you're like, I don't know, I check my PHQ-9s to make sure I'm doing
Oh, that's good. A psychiatrist that actually does what she recommends other people to do. That's
oh
great.
yeah. Well, I have to. Otherwise, like, yeah,
It's
we
just
all have to take care of ourselves. So
exactly. Yeah. Yeah, no, I guess that's why, yeah, like she just said, like, if you're like consistently sad for 1.5 weeks, just touch base with me. And that's like, so ever since she told me that, I'm like, okay. That was like, I think about, I would say like 10 years ago, when I was like, okay, now I have this plan. I haven't needed to resort to it. So it's
oh my gosh,
good.
I love
Yeah.
it.
Yeah.
Yeah. Oh, yeah. She sounds so fantastic too, because like that is exactly just like, you know,
Yeah. Proactive and nipping it in the bud.
exactly, exactly. And
And
I
even
love that
when I
she
went to,
said 1.5 weeks
yeah.
too.
And even when I went to drop off my book for her, she was like, so remember, anytime you see like the walls melting, she always uses that reference for my book about when I was talking about like how like I felt like the world I was in was like a Salvador Dali painting.
Oh yeah.
Yeah, so that's what she's always like your descriptions were so vivid that like if you see the walls melting, you contact me.
Yeah.
Fortunately,
Oh,
that's never happened. Yeah.
and then the images that I remember from your book are all the food that your mom cooked that you couldn't eat. And I was
Yeah.
just like sitting there like, oh my gosh. Oh
Can I eat it?
yeah.
Well, if I can ever manage to take it all and send it down to Tallahassee, I'll try.
Thank you. I appreciate that.
So
Okay. Well,
thank you so much.
yeah, you're
I
so
think we're coming
welcome.
down to a minute, so I don't want to suddenly cut off. But I really appreciate Dr. Sorensen, you allowing me to come on for this interview. I appreciate all the work that you do and all the awareness that you spread.
Oh, thank you. Thanks. And I'll talk to you soon.
Okay, take care. Bye.
Bye.